Morphological changes of the left ventricular endocardial surface is studied in this paper using a bag-of-words approach. Recent development of the multi-detector CT has enabled the study of complex left ventricular endocardial surface morphology and meaningful localization of affected morphology with respect to the person diameter stenosis. Comparing to our previous work, which used shape descriptors which are invariant under rigid motion, but the problem is that due to human error involved, this is not basically a problem of rigid deformation analysis. This is a non-rigid technique. So we have to move forward towards a non-rigid approach, and we choose bag-of-words because of its proven quality in non-rigid deformation cases. Here this new approach is inspired by the basic text search approach, where the document is considered as the set of frequency distribution of the words, and these words are basically comes from a word dictionary or vocabulary. Here instead of a word we have considered visual word for our problem. The process is having 4 basic steps, where the first step is to segment out the mesh from the MDCT image, followed by 17 segment model of AHA, followed by each point 23 length feature descriptor where it has shape index, coordinates, normal orientation and a context descriptor, and finally followed by vector quantization of k-means clustering to have the BOW frequency distribution. And this is a concept visualization of it, where we can see for the first kind of shape there are no candidates in it, but for the second cupped kind of shape it has 2 candidates, and for the third kind of shape it has 4 candidates, and so on. So with these visual vocabularies the frequency distribution is created. And finally in our result section we have showed that a neural network based approach is considered here for classification purpose, and disease is considered if the percentage of diameter stenosis is more than 70%. And here we can see like the territories of 3 coronary arteries, LAD, RCA, LCX are color coded, and this also shows like the mid cavity and apical has much more accuracy rate than the basal one, which is a very common factor when the clinical studies have been proposed. So it's conforming with the clinical results. Thank you.